More than a year of being on the front lines of this pandemic, healthcare workers are saying tonight we have had enough.
Not about the long hours, but about being attacked while on the job. Our chief investigative reporter, Jeremy Finley, has uncovered troubling cases of healthcare workers assaulted by their own patients.
And a warning tonight, the photos you're about to see are troubling.
It's under a Band-Aid, but it's healed fairly well.
Kelly's injury looks a whole lot better now than it did last month.
She turned and hit me all at once.
While working as a nurse practitioner at a family clinic in Columbia, she says an angry patient lost control, punching her in the face.
The third time she came back at me, she was sort of like slapping, swinging, and scratched the side of my neck.
Violence against healthcare workers has to stop.
The experience prompted Kelly's boss to hire a production company for a social media video, letting customers know they've had enough of attacks on staff.
And you have enough people like me who have employees that are getting hurt that say, I don't care about your feelings. You hurt an employee of mine.
Nurse practitioner Randy Tidwell told police he had to deny a patient's request to return to work because of prescriptions the patient was taking. Tidwell said that patient then struck him in the head 10 times and choked him until he almost lost consciousness.
Randy turned around to walk out of the room, and the guy punched him in the back of the head and then got on top of him MMA style and was punching him in the face.
Assaults on healthcare workers are prompting warnings nationwide, from the American Association of Critical Care Nurses to OSHA, citing hospitals as being one of the most dangerous places to work. While healthcare workers tell News 4 Investigates they don't believe the pandemic has made patients more on edge, they say the problem is an overwhelming need for immediate gratification, especially when it comes to pain medicine.
If you say no, you are putting yourself in bodily harm because these people will hurt you if you say no.
The attacks on healthcare workers come as the state just passed tougher legislation, making it a felony to assault a nurse. Hospitals are also taking the step to try to teach employees how to de-escalate certain scenarios. But again, as you just saw in that story, oftentimes these nurse practitioners never see it coming. Tracy?
Jeremy,